This is a FarmDoc Daily webinar. I'm University of Illinois Extension's Todd Gleason. Today, H5N1 in America, understanding the outbreak and the Illinois response. Our panelists for the day include Guy Sprouse. He's a dairy equipment specialist at the state rating office and the state rating officer at the Illinois Department of Public Health. He's here at IDPH and on campus with us today. Joining us from the great state of Nebraska is Matt Nonnenmann. He's a professor at the University of Nebraska Medical Center, and Josie Rudolphi is here. She's the center deputy director at the Great Lakes Center for Farmworker Health and Wellbeing and member of the College of Agricultural, Consumer, and Environmental Sciences. She's going to guide us through most of the day. Good morning to you, Josie. Thank you for being with us. Can you tell me a little bit about the agenda for the day?
Absolutely, and thank you all for joining us today. We have what we think is going to be a really informative webinar. As a reminder, this is the first webinar in a two-part series. So I'm going to provide a little bit of background about the Great Lakes Center for Farmworker Health and Wellbeing, also some resources we have available through Illinois Extension. Then we have Matt Nonnenmann, industrial hygienist from the University of Nebraska Medical Center. He's going to talk about a couple of studies that are ongoing in response to HPAI, and then we'll turn things over to Guy Sprouse with the Illinois Department of Public Health to talk about some of the testing and surveillance activities that are either started or will be starting in Illinois shortly. As Todd mentioned, I'm Josie Rudolphi. I'm faculty at in the Department of Ag and Biological Engineering. I have an extension appointment, and I serve as the deputy director of the Great Lakes Center for Farmworker Health and Wellbeing. This is a federally funded center that's focused on providing resources and services to farm workers in Illinois with the intention of helping to prevent injuries and illnesses among farm workers, also providing employers with resources and services so that they may protect their workforce. We're doing a number of activities around H5N1, including developing resources for employers and some resources for farm workers. If you have any specific questions or concerns or are in need of any specific information for your employees, please contact me directly and my information will be available towards the end. All right, we also want to acknowledge, I do a lot of research and work in the farm stress and mental health space, and we certainly want to acknowledge that H5N1 is a developing or emerging situation on farms. We certainly acknowledge that the unknowns around situations like H5N1 create a lot of uncertainty, and with that comes stress, and in some cases, some anxiety. So I want to make sure that people in Illinois are aware of some resources we have available through Illinois Extension and the Great Lakes Center for Farmworker Health and Wellbeing. We have free mental health vouchers available to individuals engaged in agricultural occupations in the state. There's a QR code there. You can request vouchers. These are absolutely free. We also want to promote the Ag Concern Hotline, the number there. This is a hotline available to anybody in the US where you can talk about agricultural specific issues, including legal, financial, and other, as well as receive some stress support. If you or someone you know may be at risk for self-harm, we certainly encourage anyone and everyone to reach out to the National Suicide Prevention Lifeline at 988. And if you're not in Illinois, but you are joining us from maybe the Midwest, we have a number of farm-specific resources available at farmstress.org, where you can learn about resources and services that may be available in your state or in your region. So we invite you to check those out. You can also learn all about the resources I've already mentioned at farmstress.org. So with that, I'm going to turn things over to Dr. Matt Nonnenmann to talk about a couple of ongoing studies related to HPAI.
Hi, everyone. Thanks so much for the opportunity to present to you today. And my name is Matt Nonnenmann, and yeah, I'm a researcher at the University of Nebraska Medical Center, and I also work with another, what we call Ag Center, that the region is focused on states very near to Illinois. It doesn't include Illinois, but one of those studies is in direct response to HPAI in dairy and poultry, and then another one is with collaborators from Texas A&M University, which is really a study of national scope. And what you see here is kind of the Ag Center team that we have in Nebraska. Really great team with a variety of experience in public health and outreach to agricultural communities. But taking a quick step back, I have to introduce myself. So I did grow up in Illinois, even though I work at Nebraska, and my dad's farm was in small little Putnam County there in the middle of the state along the Illinois River. And so I spent many weekends. Should I add another many to that? But going to the farm and, working on the farm. So I have experience with Illinois agriculture, and then my grandparents farmed in eastern Iowa, and currently I live in Iowa, but work in Nebraska, and still have some producers in my family. So anyway, just kind of giving you a little perspective on that, and I did graduate from the University of Iowa, and I didn't wear my Hawkeye colors today. So, of course, we got to go there just a little bit, right? So so anyway, okay, well, I guess we'll get back to work here and talk a little bit about the HPAI work that we're doing. So the first study is it's an outreach study to try and distribute to people working in agriculture. What do we know about HPAI, and what can we do about it? And so often this term personal protective equipment is used and suggested, and there are some recommendations available for that, but basically those recommendations were based on a lot of information that I'll share with you a little bit later. So a little bit more robust recommendations, and the applicability of that PPE ensemble that's been recommended by the CDC is not really practical. And we'll talk a little bit more about that. And then the second study is the one I mentioned. It's a colleague of mine, Dr. David Dufresne, is the principal investigator of that study. And we've had many years working together in the dairy industry productively. And basically it's a seroprevalence study to see, hey, are folks developing antibodies to H5N1? So that means they're exposed sometime, during work or near animals or other people. And then of course the disease burden, are people getting clinical disease, meaning are they getting sick? And so we're seeing just a very little bit of evidence of that, but not a lot. So that's encouraging. We're kind of optimistic about that, and hoping that the disease burden isn't substantial. Okay, next slide. All right, so I mentioned CS Cache is this ag center, and this is the region that we focus on in CS Cache. Notice there's, Iowa, Missouri, Kansas, Nebraska, the Dakotas, and Minnesota. Not Illinois, but Illinois is our friend, so we help out Illinois whenever we can. So a little bit about background in this region. Clearly the outbreaks have happened, and it's resulted in flock depopulation. One of the first major depopulation events was, on May 30th, where 4.2 million commercial egg-laying chickens were depopulated because of infection, and it's really impactful. I mean, at the producer level, having to euthanize your flock is talking about mental health, right? I mean, you work really hard to keep these birds producing, and then you have to put them down. It sounds terrible. So, and that's kind of been the story, throughout the region and in the United States. And these are some more recent data. So, 159 million birds affected. It's a lot, right? Counties affected, states affected, every single state practically. And reported outbreaks around 1,500. So the problem isn't going away, and that's challenging for agriculture, for producers, and for the price of eggs. Okay, so some more recent data. I think in the state of Iowa, you can see there's 30 million birds that have been euthanized. So it's hugely impactful, right? And of course, our neighbors in Illinois, fewer. But you know, Iowa is one of the largest producing egg. It is the largest producing state for eggs in the nation, and so clearly we want to try and control disease transmission, and we don't want to have to put down our birds. California is clearly affected, and of course, you know, Ohio is clearly affected, with other states being affected as well. So a little bit of background. So the dairy industry experienced an outbreak of H5N1 that resulted in spillover to workers. And, you know, it's really kind of unclear how the cows may have been infected. And, you know, it's really unprecedented, you know, that dairy cows were infected by this H5N1 that hasn't happened in the past. And that causes a lot of angst, you know, among public health people and, of course, folks in agriculture, because we want to control infections of influenza as much as we can. And I was actually working in the panhandle of Texas, you know, on another study, a dairy study, when kind of things were happening with my colleague, Dr. Dufresne. And so there's lots of questions about, well, how did it happen? Why did it happen? What can we do to control it? Is it a problem? Is it not a problem? It's really many, many, many more questions than answers. And so I'll give a little bit of background here on H5N1. So, you know, the workers in farm families that may be exposed to the virus, you know, during when animals are infected, or, you know, if animals become sick and you're treating them, or obviously during depopulation. And so the disease burden, meaning like how sick do people get when they're exposed to the virus, that's still unclear. But like I said earlier, you know, having reviewed in the last few weeks, reviewed the quote, there's a website called FluView, where you can go and see, like, well, where are is the disease burden for influenza happening in the U.S., and who's it affecting? And we weren't seeing a lot of H5N1 morbidity, mortality showing up. It's more seasonal flu, and so there's questions about that, but that's good news. That means, well, hopefully, if people are exposed to this virus, you know, they're not getting real sick. So we're trying to learn more about that. Okay, so this is kind of where I tell a little backstory. And again, I borrowed this figure from the internet because it's really, really telling. I really like it. So you can see this is a Venn diagram. We probably all remember them from grade school, right? These circles. And so we have birds, we have humans, and then we have pigs. And then, of course, the sweet spot here where they all overlap, that's where you see our H5N1. And so that means that virus can infect people, it can infect birds, it can infect pigs. And kind of the scarier part, and why people were making a big deal about this, is if you look up on the right, I'll kind of zoom in here, some initial events resulted in pretty high morbidity, mortality among humans who were infected. So we were really concerned about that. It's like, okay, well, are people getting really sick from this virus? And so, you know, currently the circulating virus, it isn't showing that we know of, that level of mortality, and that's fantastic, right? We don't want that to happen at all. And then kind of the second big point, and this is from, these data are from 2013, is that you don't see cattle in this Venn diagram. So there's not a third or fourth circle with cattle with H5N1 in it, and that's the big concern for us. Is, you know, it's another species or group where we have a lot of cattle in the U.S. and often the cattle aren't too far from pigs, birds, or people, you know, and so it's like, are we going to have more transmission, which could result in, we don't want that to happen, but could result in, you know, another pandemic. And you can see here at the bottom the swine flu, the Spanish flu from 1918, you know, so that was a variant that killed a lot of people around the turn of the century. So we don't want that to happen. Okay, and so this first study that I was talking about, again, distribution of educational materials and some personal protective equipment packets, just, and gloves, face shields, some gowns, and I think we put an N95 in there as well. The goal is so people have some equipment if they want to use it. It's completely voluntary, and so our goal is to distribute some of this. And if you observe disease on the farm, and so you have something that you can put on or wear or do something to manage that problem. And one of the challenges in public health always, and on a farm, if you observe disease, you don't know what it is at first. And so it could be kind of the run-of-the-mill disease, or it could be something that's unique. So that's kind of the goal. And then also to educational materials, so people can learn about H5N1. So where we're at now, so we're developing these print materials, we're creating videos of how to put on PPE and how to take it off in a way where you can try and avoid contaminating yourself. So we're working on those. And then we're also disseminating these kits that include some basic PPE to our CS cache region. So we're happy, but if folks from Illinois, if you want a kit, we'll send you one. We'll do it until we run out. So that's our goal. So please, you can contact me or Josie or the folks at the farmdoc team, and we'll share what we have. A little bit more update. So this is, obviously, if you haven't spent much time in the dairy industry, I mean, I had my memory of what it was like, and I did some research on some pretty small farms in northeast Iowa. And of course, this is really kind of more the reality of current farm technology, which is fantastic. I mean, we need this technology to be able to take care of our cows and our people and enjoy the milk that we use every day. Here's a little video of just kind of the work stream in a dairy parlor. So it's very fast paced and it's hard work. And I like to show this because, sometimes when, say, the CDC gives some recommendations for PPE, it doesn't really put the work in context. And so, when you're working in environments like this where it's, it's wet, sometimes it's really hot, and you're working 12-hour shifts, to take care of those cows and to get them milked, sometimes PPE recommendations don't always coincide with what the work looks like. So I like to show that little clip so folks get a perspective. And here they just finished the post dip on the cows that they milked. So progress on our we're doing conference calls with extension and public health partners, and we're also meeting with other centers like Josie Center or other centers that have these H5N1 projects, so we can hopefully have a cohesive message to producers, which is always a challenge, but that's our goal. And then we're also working with dairy and poultry commodity groups, and they've been really supportive. And one of our messages is to encourage seasonal flu vaccination, because we don't want the mixing of virus. So if a seasonal influenza virus, someone's infected with seasonal flu, and then let's say they're exposed to H5N1, those viruses, they like to share genetic material, and that creates a new viruses. And so avoiding that co-infection is the goal. And so again, our target is to do co-branding with extension and commodity groups. So it's not just us sending out the message, and then also working closely with biosecurity experts and just encouraging additional hygiene, perhaps, and of course seasonal flu vaccine. But one of the challenges that we've faced pretty consistently is just this lack of trust among producers, and so we're trying to overcome that by listening to our stakeholders and hearing what they say and being responsive. And kind of the last step is, we have purchased databases of dairy and poultry farms throughout our region. And so that's going to be our primary point of contact in addition to our extension partners. And of course, utilizing relationships with the public health clinics for so that folks know where to go to get vaccinated if they want to do that, and then keep sending out these educational materials and PPE kits. So as I mentioned, we have these databases of farms and our own extension network. But if you are interested in the state of Illinois of receiving a PPE kit or any sort of educational materials, please let us know, and we will send one to you. And then if you have opinions, like say you don't like the PPE or you have suggestions about other things that we could do, we'll reach out, tell us what you think. We're good listeners, and we listen to our stakeholders, and that's our primary approach. Okay, really briefly, this second study, again, the PI, Dr. David Dufresne. Basically, Dr. Dufresne is working with dairy producers to, it's a 12-month project, very fast project, and the goal is to visit farms and collect blood samples from workers and see what the antibody levels are on these workers. And so it's completely anonymous to producers, owners, and workers. And it's been approved by all of our research board that reviews our methods. And so our progress, we've contacted farms, workers are being enrolled and have participated. The data collection is ongoing and has been successful. So we've gotten interest from producer groups. And let's see if we trying to advance here. There we go. So sample analysis is ongoing and those data are being summarized. And so we're going to complete the project in July 2025. And there might be some additional funding given the problem isn't going away, for additional data collection. There we go. So if you have any further questions, you want to learn more about what we're doing, feel free to reach out to me. Also, if you have questions about Dr. Dufresne and his project with the seroprevalence, please reach out. We will put you in contact with Dr. Dufresne to learn more or potentially participate. Thank you.
Good morning, everybody. My name's Guy Sprouse, and I'm the Dairy Program Manager at the Illinois Department of Public Health. I'm also the State Equipment Specialist and Rating Officer for Federal Compliance for Interstate Milk Shippers. I'm going to talk briefly today about the H5N1 sampling plan that is going to be going into effect, and I will welcome questions afterwards. Just for reference, I have my master's in food science and nutrition from the University of Illinois, and I've spent over 30 years working in public health, specifically in food safety, and the last 20 years dealing exclusively with grade A and manufactured dairy farms and processing. So, getting forward.
You got to click up on that thing.
Oh, click where?
There you go. Do it again.
There we go. All right. Beginning on December 6th, 2024, the USDA issued a federal market order that pertains to raw milk silo sampling. Each state milk regulatory agency was tasked with collecting commingled raw milk samples from the dairy plants and silos across the state. From this, we hope to get an overview of what's taking place. A term that I need to discuss is bulk tank units, or BTUs as they're called. This is a grouping or clusters of farm who pool their milk and ship it at together for marketing purposes. When we go out, we're going to be collecting silo samples of this milk. A broad net is going to be cast at this point, and the information is going to be limited. All we are going to know at this time in the near future is, did that plant have milk with H5N1 virus within it? because of the way it's going to be sampled, going back to these bulk tank units, it's not going to identify farms. It's not going to identify a specific unit. So we're going to have limited results coming forward. This sampling will occur at monthly intervals. Each month, the Illinois Department of Public Health, the dairy program goes by the dairy plants in the state, and we collect samples of their raw milk used for product processing. We also collect an assortment of finished products from a matrix of choices so that we have a valid and representative sampling of all products in the facility. But in this instance, we're going to look specifically at the silos. We have identified 24 dairy plants in the state of Illinois, and we have 7 direct ship farms across the state that have been selected. These are farms that do not use a bulk tank, but they use glycol chillers, and they pump the milk directly into an over-the-road tanker for shipment and easy distribution. So these are very large farms. One of the qualifications for this sampling exercise is the plants must receive grade A raw milk, and they must be from an interstate milk shippers listed bulk tank unit. The interstate milk shippers list is the federal list of approved dairy farms or bulk tank units and dairy processing plants that can ship grade A product in interstate commerce. One sample will be collected from each silo with raw milk at the time of sampling. For most plants, this is going to be anywhere from 2 to 3 samples. It could be as low as 1 sample per plant. And I've got a couple where we could be looking at 7 samples or more. Ultimately, we're hoping to collect about 70 samples every month for the near future. At the time of the collection, we will only record the bulk tank unit numbers of the trucks whose product is in the tank at the time of sampling. And I told you, this could be a very broad net we're casting and just trying to figure out what is going on across the US. Inside of that silo at a dairy plant, they are only required to wash and sanitize it every 72 hours. So theoretically, you could have multiple trucks pumping milk into that same tank over a 72-hour window and co-mingling their product. The testing methodology is so specific that it's estimated we can detect one infected cow out of 70,000 in that tank. But when you keep pulling milk from it and adding it, we just keep decreasing the odds of finding out what the source was. So this is why the BTU numbers are kind of limited at this point in time. And stage 1 is just looking for. Stage 2 happens when we are triggered by a positive plant sample. And from that positive plant sample, we can trace back and identify the bulk tank units whose product was in that silo or commingled with it up until the point of collection. This becomes a new headache because the Illinois Department of Agriculture is required to begin an epidemiological investigation to identify the infected farms. This is not going to be easy and guesswork and a lot of phone calls and questioning, but we also have simpler solutions to help figure out and investigate further. One thing we have the availability to do is trace back, and this can be conducted using samples collected by the bulk milk hauler sampler, which follows the tanker to the dairy plant with every load of milk picked up on a farm. The purpose of this was originally for traceback of antibiotic residues in milk. There is a 0 tolerance residue for it as an allergen. So when milk comes into a dairy plant, the first thing it is done, the whole tank is tested for traces of antibiotics. If it is found, the plant goes back and they test each individual sample from the farms that came up on that truck. What we're going to propose, or what we are going to do, is if we have a BTU that we can identify or examples of them in Illinois, we're going to be able to go back to the plant and collect truck samples or targeted specific samples from individual farms. This should ease the process of identification, but it should also keep people from the Department of Ag or Public Health from having to visit your farm and make special trips to collect the samples. And visiting a farm just increases the risk of a biosecurity issue of cross-contamination going from place to place. So stage 3, which we hope to begin in the near future this spring, is going to be bulk milk tanker testing. And these will be sampled individually at the dairy plants. One day for a 24-hour period of each month, we will have samples collected from every milk tank truck arriving in a facility, and we will test those. The beautiful part about doing a bulk milk truck is it's easier to identify the producers that are on it. Instead of this huge broad net, we can identify a positive truck, and there's only going to be on average 2 to 8 farms whose milk is in that tanker. Once again, we can go back and we can use those subsamples and we can trace it back to the individual producer. Stage 4, this begins when several months of results show that there are no presence of the virus within Illinois. At this time, it does not include the poultry flocks. This is specific for bovine. And when it happens, we're going to back off a little bit. The sampling frequency is going to be reduced. We are not going to be sampling silos every month. We're not going to be sampling every truck that comes into a plant every month and trying to do extensive traceback. The ultimate goal in this initial phase is that we're going to capture 90% of the milk produced in this state and be able to eradicate or limit the virus being transferred back and forth. Stage 5 is called freedom from H5N1 determination, and this only happens after all 50 states have progressed and are in stage 4. Even with good testing results right now, this would not be possible since we still have active cases in Nevada and we have them in California ongoing also, but this is the goal. And this will be determined by the U.S. Department of Agriculture at some point in the future. One thing that I do like and stress that all dairy producers understand and know is that if your flock tests or your herd tests positive for H5N1, your milk is still going to be accepted at the plants and shipped and processed. We know that pasteurization is 100% effective in destroying the virus. There is no risk there. You would segregate the sick cows to hopefully protect your uninfected cows. But if your cows test positive or your farm tests positive and your milk production does decrease, there is funding available from the USDA to help offset your losses. There are also funding available through the USDA for you to enhance and increase your biosecurity on your premises. However, if you do not test your cows and you suffer H5N1 and the economic losses, these funds are not available for your use. And hopefully this strategy and simplified sampling method will keep stress off the farmers, keep people off your properties, and help make this be streamlined and efficient.
Thank you, Guy. I appreciate that. If you've got questions for Guy or Josie or Matt, go ahead and put them into the question box. Remember, that's up the top right-hand side of the page, a little box with a question mark in it. Hit that and you can tap out that question to us. We'll get them answered momentarily. If you're here, you're already signed up for next week's webinar. That's the H5N1 Prevention Strategies webinar that'll come up on Tuesday next week at 11 a.m., including Mark Ernst. He's the Illinois State Veterinarian, and Tasha Bunting from the Illinois Farm Bureau, who is the Director of Commodity Programs and Farm Systems there. Our sponsors for the day include the TIA Center for Farmland Research, CoBank, Compeer Financial, Corteva AgriScience, Farm Credit Illinois, Growmark, FS, Illinois Corn Growers, and the Illinois Soybean Association. And our educational partners are, of course, the College of Agricultural, Consumer, and Environmental Sciences. That's the College of ACES right here on the University of Illinois campus, along with its Department of Agricultural and Consumer Economics, University of Illinois Extension, the Gardner Agricultural Policy Program, and FBFM. That's the Farm Business Farm Management Record Keeping System here in the state of Illinois. We'll turn our cameras on and take your questions in just a moment. Just a quick reminder, if you'd like to see this again, you can always do that on our YouTube channel at farmdocdaily.illinois.edu. / and then into the archive section there, but the YouTube is youtube.com/@farmdoc. You'll find many things there, including my daily radio programming called the Closing Market Report, the Commodity Week as well. You'll also find the 5-minute farm docs and many of the other webinars that are produced out of our studios each and every week here at the University of Illinois. So Guy, want to start with you. We have a series of questions, but I have a question off the top of my head. In the 1990s, I spent a lot of time with the dairy industry, learning a little bit about how all of some of this testing worked. And at that point, it was made very clear to me that milk was the most tested product in the agricultural sector. I assume that remains the same today.
It does remain the same. On the farm level, we're looking at the presence of total plate counts, somatic cell counts, presence of any inhibitors. On the plant side, we delve in monthly and we have diseases of choice that we can sample for, like Salmonella, E. coli. We test the milk for total plate count, coliforms at the dairy plant. We also look for an agent or an enzyme called phosphatase, which indicates that the product was properly tested. Those are the minimum tests that we do. As now you know, we're going to be ramping up for H5N1. In the past, we've also done surveillance for pesticides and herbicide residues in the products. It still is the most tested and the most regulated commodity in the USA.
Josie, I think I'll let you go through the series of questions as you have them in front of you, unless you want me to read them out loud, but you and Guy have them there. Matt can see them as well. So if you take us through those, I'll follow along.
Yeah, we have a couple, thanks Todd for facilitating here. We have a couple of questions related to I'm not sure if they're specific to Matt or Guy, but the first question is, how do you think the new strategy that seeks to not reduce overall inoculum load in the system by eradicating infected flocks will impact virus spread and mutation frequency?
I have to run that one by
Matt, do you have
I can't see the question, so it would be great to hear that one again.
Definitely. So how do you think the new strategy that seeks to not reduce overall inoculum load in the system by eradicating infected flocks will impact virus spread and mutation frequency? So this question may have, I know there was a news article out this morning.
Yeah, it seems to me it's not worded quite correctly as well. So they're asking whether or not the potential new way to, and I think they mean not to eradicate infected flocks, but rather to vaccinate them. How might that impact the virus spread?
Yes, I think you're absolutely right. So the question is, we've done mass depop when in bird herds, especially herd flocks, especially when we have a case. And so there's a proposal that we maybe not do it that way and instead try to medicate and or vaccinate. So what would that do to potential virus spread and mutation? And then also, I think a follow-up question, which kind of has also been posed, is we've had conversations about immunization, medication. Are there any potential challenges to international trade, international consumers, if we are able to immunize?
I can say something quick. I think vaccination is clearly the way to move forward. And I think that hopefully we'll have more options there as science advances in that area. And you're right. I mean, depopulating seems like an incredibly drastic approach, to control it. But it's kind of the standard approach we've had and used. but now that, other animals are infected, like cattle and wildlife, it's like it really raises that question of, do we need to depopulate? Can we control it in other ways? And I think that's really important to look at, because, I like having a couple eggs for breakfast, and I like it when it doesn't cost, like $5 for breakfast in my own kitchen, so I think finding new ways is really important, and that includes people too, thinking about vaccinations for people, and so those are just some initial thoughts.
And I totally agree with Matt. We have vaccines. They're available or could be made available, experimental ones, but the issue comes back to European trade and their dislike of certain vaccinations because it could mask disease that is still in the animal and reduce the numbers, making it harder to detect. Unfortunately, the virus is spread through so many mammals across North America and avian species that it's going to be hard to get a control under. And Europe someday is probably going to experience the same events with the migration of migratory birds yearly. The downside is, I don't know that there would be any effective way of testing, but I do know that the vaccines have been nixed from use in the US in the dairy cattle because of beef products, dairy products, overseas shipments. And Dr. Ernst, one of the speakers next week, could talk pretty in depth about this. He's the one that educated me on the topic.
I would say a couple of resources that you can get to. And Matt, if you're looking for the questions, the easiest thing for you to do is to probably just hit the pop out button down at the bottom right-hand side of your page, and the questions should pop out. It'll break everything apart, but you should be able to see the questions at that point, I think. And then for those of you who are looking for more information about this on this particular question, if you go to farmdocdaily.illinois.edu, that's on your screen at the moment, and you scroll to the bottom of the page and look for Farm Policy News. One of the most recent articles, and these are all rewrites or postings of articles that somebody else had written. In Farm Policy News, there's an article titled Trump Admin Shifting Away from Depopulation for Bird Flu. It's by Philip Basher. He is with AgriPulse. I traveled with Phil to Europe. He was with Des Moines Register years ago now, but he does a really good job. So you can read through that. Josie, what's next on our question list?
Yeah, great resources there. So we talked a little bit about the vaccines. So I think we cleared up some of those questions. Maybe a question for Guy is will products made from unpasteurized milk, and maybe a little bit of an insight into what unpasteurized milk is being produced for here in Illinois, also be tested?
All right. As regarding unpasteurized milk products, at this point in time, the only unpasteurized raw milk product legally available in Illinois is hard-aged cheeses that meet a standard of identity from the Code of Federal Regulations, and they have to be aged for a minimum of 60 days. Research has shown that this is a new topic. In the past, the research has shown that the pathogens of bacterial nature do not survive or are not viable after the 60 days because of the low moisture, the high salt content, change of pH. We also have competitive bacteria going on that is playing warfare. But anything else is not allowed because of high risk. The question is, will the virus survive the aging process and these chemical restraints? And that is something the FDA has been looking at recently, but we're not actively looking at it right now. In fact, I'm not sure if we have a test methodology to look for it in finished cheese products.
Excellent. Matt, there's a question here about human spread. So do you think the virus may be more widespread, among humans than we had originally thought? I know there was an interesting article, I think published late last week, about veterinarians who show no symptoms having H5N1 antibodies in a blood sample.
Right. Yeah. this is a guess, but my guess is that, people working in agriculture, have been exposed to H5N1, and I think that's a pretty safe guess. And then I think the next guess would be, if we were seeing the mortality that's been reported, the quote 60% or 40% or whatever that number was that I presented earlier, we would know about it. And so we're not seeing that. So I think people are exposed, and they're probably responding immunologically appropriately, and that's great news, right? And I think this isn't a new problem in agriculture, people being exposed to influenza virus, and so it's been happening for many decades and decades. And so but obviously we want to respond appropriately, and that word appropriate is always, people argue like what's appropriate. And so that's kind of our it's a guessing game for us on the public health side. But I think the farm level is the most important level. I mean, if you see animals are getting sick and you notice people are getting sick, then trying to respond to protect yourself and your family, by seeing your clinician, tell them you're working with animals. So, and we're not seeing that we know of, but I think it doesn't matter, H5N1, whatever we're dealing with, because this won't be the last time. Just if you see that, be responsive, and that's the best answer I have.
Excellent. So sort of on that topic, are there educational materials available for producers outside of Illinois? I know we're in the process of developing a few for employers, just things, best practices for keeping people protected on farms, things to watch for, obviously symptoms. You mentioned communicating with healthcare providers should you develop symptoms, reminding them where you've been. Are there other, with the CS Cash, are there other resources available that you're aware of?
Yes, I mean we're currently developing. As we learn more, we're modifying our resources that we have available. And so if anybody wants, either electronic, print, or PPE resources, for me, I don't really care if you're outside the region. We'll send it to you until we run out of materials. I mean, that's the responsible thing to do. That's what we'll do. And if you have questions or concerns, we're happy to answer those as best we can.
Yeah, thank you.
Another good source, the Centers for Disease Control, has quite a few documents aimed toward poultry producers, dairy farmers, home flocks regarding PPE, H5N1, and good safety practices. And these are available in multiple languages.
Yeah, I will say the National Center for Farmworker Health has also received some funding to develop resources specifically for employees on farms. So there are a couple more questions about vaccines, acknowledging time and realizing that we will have Dr. Ernst on next week, who's our state veterinarian, who I think will have more information with this sort of evolving vaccine conversation, and guidance for what we might expect in Illinois. We might save those questions or those types of questions for him. As a reminder, register for next week's vaccine, register for the vaccine, if only it was that easy. Register for next week's webinar if you have not already. Even if you're not able to be present in person, you'll get a link to where you can find that webinar archived. There are a couple of questions about federal funding. So we know that a lot of our public health efforts and even compensation for farmers who maybe lose production are all funded through USDA or similar initiatives. So there are questions about ongoing federal cuts affecting prevention and surveillance that maybe Guy can speak to.
Currently, activities taking place by the USDA have not seemed to take the same hits as agencies under the Health and Human Services umbrella. In the last 3 weeks, we have been cut off from a lot of communications and updates with meetings involving our partners at the CDC and the FDA. And we've lost out on great information such as Morbidity and Mortality Weekly, where they were going to talk about H5N1 cross-contamination in veterinarians. that is stemming our activities. But I do think USDA is very active, and the funding is going to stay in place at this time for their purposes.
Excellent. Indemnity payments, that's
That I would defer to Dr. Ernst
Yeah.
next week, since public health does not deal with the poultry directly as regulating them the way we do milk, but he has been involved in the depopulations that have occurred in Illinois in the last year. And I think he could give you better insight.
mhm. Yeah, there's another question about the Center for Farmworker Health and Wellbeing and whether we may be subject to the federal chopping block, and that still is yet to be determined. But I think we all live in a state of uncertainty with some of our programs here. The last question, Matt, is do you know, do blackbirds carry H5N1? And what about geese and deer and maybe some of our other backyard animals, backyard pests?
Yeah, so great question, and I think that's one of the primary hypotheses of how H5N was introduced on dairy farms was through the wild birds. But there could be other sources. But my gut is we don't have information on all the species so far because they're migratory and it's changing. But my gut is to say, yeah, I mean, just keep those animals away from your livestock as best as you can, and the water sources, the feed sources. I mean, follow the basic biosecurity recommendations that are available from a lot of people that are smarter than me who've developed those. But I think it's good to be as cautious as possible. I think cats, controlling farm cats' access to your property, that's another animal to consider. And yeah, I think and some folks had mentioned rodent control earlier. I think staying up on your rodent control, your pest control is also really important until we kind of learn more about what's the most effective way to control transmission on the farm. And I guess a third thing too is that a lot of folks have backyard flocks with a variety of animals, and controlling the access of wildlife to your backyard flock is really important. And we're seeing kind of some of these cases where people have backyard flocks and they've maybe developed some disease, and there's questions about, well, why is it disease and why isn't it like subclinical where we don't see disease? There's lots of questions there, but I think protecting your backyard flock and those are all kind of good cautious strategies right now.
Mhm. Yeah, I think the latest number I heard was that it's in 200 species,
I could believe it.
and so it's hard to say with confidence where it is and is not, and it's clearly everyone's subject, seems like.
But we've seen it in such a variety of species. We've seen it in polar bears, black bears, seals, farm mice. Cats on the dairy farms are a great sentinel.
Mhm.
I shouldn't say it that way, but if a cat gets infected with H5N1, it develops very severe neurologic symptoms within a matter of days that at first mimic rabies infection. And it's highly fatal to them. So if you start seeing cats die off, contact your public health veterinarian. That is something we are looking at as a testing species as a sentinel. I think our natural resource department is not actively seeking out wild bird die-offs like they did in the past because they're seeing so much of this virus. But we keep learning. And at this point, I think the short answer Matt was getting to was it seems to be able to infect almost all mammals at this point in any avian species.
Mhm.
And so it's going to be a challenge, but we can work on it.
With that, Josie, I think we probably should close out as we're coming up on the end of our time. Thank you all for being here. Josie Rudolphi, of course, is the Center Deputy Director for the Great Lakes Center for Farmworker Health and Wellbeing. We've also been joined by Guy Sproul's. He's the Dairy Equipment Specialist and a Dairy Manager for the Department of Public Health, that's IDPH, here in the state of Illinois. along with the University of Nebraska Medical Center's Matt Nonnenmann. We appreciate you being here for the day. Behind the scenes, Jim Baltz has been making sure things have been going very, very well. Remember to fill that survey out as you leave. And we thank you for joining us here on a FarmDoc webinar. You're signed up already for the second in this series. That'll come up at 11 a.m. on Tuesday. That's Central Time next week. I'm University of Illinois Extension Farm Broadcaster Todd Gleason. You have a good day.